Hi, it's Dr. Axon again, and welcome back to the medical facility. In this video, we're going to take a look at some of the things that can go wrong with your nervous system, because sometimes it doesn't function perfectly. We'll cover diseases and disorders such as traumatic brain injuries and Alzheimer's disease. Let's first talk about traumatic brain injury, or TBI. A TBI occurs when there's an external injury to one's head, like when someone's head gets hit really hard. Some TBIs can be more severe than others. They can range from a mild injury or a concussion to a much more severe injury that may require emergency treatment. While all TBIs are caused by an external impact to the head, lots of things can cause TBIs. For example, car or bike accidents, falls, and playing sports without proper safety equipment can all lead to the head injuries that cause TBIs. So how does a TBI actually happen? The initial impact to the brain can damage blood vessels inside the brain. It can even also stretch or tear the axons of neurons, which can sometimes lead to the death of neurons, especially on the outside of the brain, closer to where the injury happens. But in more severe cases, the initial impact is actually not responsible for most of the damage that happens. In fact, the damage from severe TBIs mostly comes from the later effects of the initial injury. For example, bleeding can occur in the brain, which leads to a rise in pressure inside the skull. Since there's not a lot of room inside the skull, a rise in pressure can push on cells in the brain, causing even more neurons to die. Mild TBIs can cause symptoms like confusion, a loss of consciousness, headache, and dizziness. For moderate or severe TBIs, symptoms like loss of consciousness for hours, nausea, vomiting, and a loss of coordination can occur, and they usually occur to a more serious extent than for mild TBIs. If you ever experience any of these symptoms after taking an impact on your head, it's important to seek medical help since a TBI can be very damaging. Typically, mild TBIs won't cause significant long-lasting damage, and lots of rest is usually enough for them to heal. To alleviate some of the less pleasant symptoms, like headache, pain relievers may be used. However, for more severe TBIs, more extreme measures, like surgery and stronger medications, may be required for treatment. In all cases of TBIs, rapid treatment is essential to making sure that there is as little permanent damage as possible. Fortunately, there are a few ways to lower your risk of TBIs. For example, wearing a helmet while biking or wearing a seatbelt in the car will make it less likely that your head will suffer a serious impact. In general, anything that can protect your head will lower your risk for a TBI. Now, let's talk about Alzheimer's disease. Alzheimer's disease is a neurodegenerative disease, which means that it causes gradual degeneration or a decline in function of the brain. It gets worse over time, and it's a disease that normally affects older people, usually people over 65 years old. The main symptom of Alzheimer's disease is dementia. Dementia refers to a loss of memory as well as a decreased ability to think. Patients with Alzheimer's find recalling memories harder than normal, and they also have more trouble thinking and understanding. Further symptoms of Alzheimer's might also include problems with language and disorientation, which are all related to the decline in function caused by Alzheimer's. Currently, scientists don't actually know a lot about what causes Alzheimer's, and a lot of research is focused on finding its causes. Alzheimer's frequently involves neurons in the cerebral cortex, which is a region of the brain involved in language, perception, thought, and memory. In Alzheimer's, many of these neurons die out, causing the decreased ability to think. However, we don't quite know what causes these neurons to die out. The current hypothesis is accepted by most researchers, but hasn't been conclusively shown yet. This hypothesis states that a protein called the amyloid beta protein, quote-unquote, goes rogue and causes cell death. This process of going rogue is also called misfolding, and it means that the protein adopts an unusual shape and creates tangles, which can possibly cause cells to die. Because we don't know how Alzheimer's works, it's difficult to develop effective treatments for it. So far, there are no medicines that can conclusively stop or slow the progression of Alzheimer's. However, supportive care is typically available for patients with Alzheimer's, and this includes helping patients perform day-to-day activities normally. Since we don't know the mechanism behind Alzheimer's, we also don't know how to prevent it most effectively. However, keeping a healthy heart and maintaining a healthy diet have been associated with a lower risk for Alzheimer's. In addition, taking part in intellectual activities like doing crosswords and puzzles, playing board games, and reading has also been associated with a decreased risk. So today, you've learned a lot about traumatic brain injuries and Alzheimer's disease. I hope you learned a lot, and we'll see you next time.